Welcome back, everyone, to another episode of the Manifesting Health series. I'm Bordelon, your host again, and we're really excited today because we're going to have someone that's brought some really meaningful work over many, many years, decades of work into the nursing space, especially most recently with a book. So we're going to spend a little time talking about that. But I want to introduce our guests. We have Dr. Shelley Burke as a registered nurse who holds a doctorate in nursing practice and is a clinical assistant professor from UC Irvine School of Nursing out in California. Born in Guyana, South America, she is also a global ambassador for nursing and has built a vast 40-year career in healthcare and hospitals, academics, and as well as a travel nurse. All this valuable experience has been brought together in one of her books, The Unsung Heroes, Nurses. Hello, Dr. Burke, and welcome to join us today.
Well, thank you for having me, Curry. I appreciate that.
Excellent. So we're going to jump right in, what we usually do, and tell us a little bit about yourself and what got you in the space that you're in, and what kind of got you to the point of writing a book.
Yeah. Well, Curry, you read a little bit about my bio there. Yeah, I was born in Guyana, South America, but always had that desire from a very young age to become a nurse. And when I came to America as a young person, I immediately enrolled in nursing school. As a matter of fact, that time in history in the 80s, it was very hard to get into four-year college. So I had to start where I was, and I entered that LVN program, and from there my nursing interest career started, and then I eventually got into four-year college and then move on to get my master's and then eventually my doctorate. So it was a long journey, of course, many times disrupted by family growing and children and all of those times, but I was always determined to stick to a career that I have a passion for and also wanted to make an impact with the lives of people that I touch. So it was 40 years of enjoying something that meant something to me, making a difference in the lives of many people.
I appreciate that. It's one of the things that to hear your story about starting in the LVN space and how you worked your way over time into even more and more influence is really appreciated, and I appreciate it, especially nowadays with us struggling so much to find ways to help nurses move forward. How do we help nurses to adapt to changing environments? To, from staffing to workload to hostility in the workplace. Tell us a little bit about your book and how the book helped you have a voice in helping that reader, that nurses. How did you help them through your words within the book?
Yeah, we have to recognize, first of all, that America is a multi-ethnic, multicultural country. People from all walks of life, all parts of the world are living here. And how we integrate that space with others is how we see others. And we have to see the humanity in people. We have to see that they're no different than us. Whether skin tone or hair texture is different superficially, but humanity is the commonality for all of us. And as nurses, I think it's important that we see that in our care that we're going to be delivering to the different people that come through our walks of life. And with that in mind, for me personally, when I take care of people, I want to see that I'm there to make a difference, to comfort them, to encourage them, to tell them that they may be at a better place after this disruption that is happening in their lives. And so nurses have to come to the table from the humanitarian perspective, not judging people based on your insurance company that you're affiliated with, your zip code, the color of your skin, your accent, you're immigrant or not. Those things are just superficiality. We're here to make an impact. We're here to make a difference. We're here to change lives for the positive, for the better. And I think we are the only profession that can do that. We have the most access to people in a way that no other profession can. And we have that access when they're in the most vulnerable state of their lives. And so we can be those advocates of positive change. We can be the advocates to make an impact in the world when people are trying to destroy and tear down. Let's build up. Let's use nurses who are in the most trusted profession, as we call it, to make that difference, to be that voice, to speak on those who cannot represent themselves.
I'm so glad you talk so passionately about how we are a community, how we're a community of nurses from all different populations and specialties, from all different age, gender, race. Nursing, for example, men in nursing, we're sitting around 14% or so. It
Yeah.
depends on what data you look at, but around that
Hmm.
sort of an average. And we're constantly talking about that sense of community. And we try to do it within our organization, but when we hear your passion in the same area of making nursing feel like they're part of a community, that has a powerful message to help each other through. Because COVID, we often talk about COVID, and it was a catalyst for so many things in many different directions.
Hmm.
But it truly was, it's almost like you put on a pair of reading glasses when COVID happened. These issues have been happening for decades within healthcare, specifically within nursing, but it just put a spotlight on something that exacerbated it in a way where you feel we have to make, that collective voice. And we constantly have interactions with different organizations such as Alzheimer's Association and different companies such as Vitas, but also within the Hispanic Nurses Association and so forth. And to hear it from your side as well, from the international lens, we applaud and appreciate that. And speaking of, can you tell us a little bit about your time? How are you able to connect the international experience and the international lens into this to give, for those of us who've only practiced in the United States, how do you help us understand and be more empathetic more with the international lens of nursing?
No, you have to think of nursing as an international career for everyone. It's really no different in a different country. The people might be different in terms of accents or what they do, but generally, the first line is caring for another person who needs them at a given time. And
Right.
so we shouldn't see an international healthcare provider as any different than us. They may practice slightly different
Mhm.
because maybe their development, their access to technology,
Mm.
maybe their access to advanced science may not
Yeah,
be
we,
where
we
we
we get
are.
spoiled here in the U.S. when it comes to a lot of
Exactly.
that because you
And
might
we
have eight
think that
MRI machines in
everything
a
is the
zip
same
code.
thing. I was in Guyana some years ago and I was
Yeah.
looking at this medical doctor giving some chemotherapy
Mhm.
to a patient, and it was so not so advanced at all. It's just put something in the bag, stick a needle in the patient, and we do things so differently here. And I'm going like, wow, you use what you have at the time you have it. Because she or he is still helping somebody, but that's what the sources of things they have at the given time, and they will
Right.
use it to take care of that person. So we should not judge or criticize. We should appreciate somebody who's still making the effort to
Mm.
make a positive difference in somebody's life with the equipment or the tools at hand.
Right.
And so we
And in
shouldn't
many
be,
cases, yeah,
yes,
and in many cases, they're very passionate about that. Not only
yes,
passionate, but they have really good outcomes in some of those areas
they
where
do.
they truly, it's the focus of the care and not the equipment and all this other things. And I'm not talking, more advanced equipment is not worth its time, but all by all means. I mean, it's certainly impressive some of the technologies that we've been able to push forward. However, the core of what we do is nursing lies within its own skill within that human contact. So I
Exactly.
appreciate that.
Exactly. And that's what one of my focus as a global ambassador in
Mm.
nursing has become, because I realize the commonality of our work. It doesn't matter which part of the world I go, these
Right.
people are caring for other people who need them at a given time in life. So we should see yourself as holistic in terms
Mhm.
of healthcare, not oh, that's a Chinese nurse or that's an Indian nurse, but we're
Right.
nurses. Or there's a male nurse that, and you know that for sure, how we discriminated against male
Mm.
nurses. And I've got quite a few examples in my book. For instance, Ernest Grant, who's one of the leaders of he was one of the ANA first male leaders in nursing. And being in that position as a male, you always be questioned about, well, why are you not a doctor? And
Mm.
we fail to realize male nurses may just want to be nurses, they may not have wanted to be a doctor. but yet we're willing to discriminate against the male nurse because he has chosen a
Right.
profession that predominantly has women in it, and that we should not do that either.
Well said. I appreciate you saying that. That certainly reemphasizes all of our language. We're trying in all these different organizations of the diversity. Gender diversity has evidence-based outcomes when it comes to improved patient outcomes when the care provider looks like you. So whenever you look, whether it be age, race, gender, and so forth, all of that plays into the outcomes matrix when it comes to our patients. So what has been one of the largest obstacles that you've encountered in your career that has helped influence and shape who you are in this meaningful way?
Well, sometimes as an immigrant, as a woman, as a Black person, sometimes those very obvious things become a barrier where people make an assessment and a judgment on you based on a superficial presentation of you because they have a general stereotypical view of a certain segment of the population. And so you have to constantly prove yourself beyond that stereotype. And that's a barrier that many people of color, many immigrants have to overcome because the assumption is you can't. The assumption is you don't have the ability to do. And so you have to always be proving yourself that, yes, I do have that ability. I do have that capacity just like you. And so those are obstacles you run into. And even in patient care sometimes, when I came to this country as a young person and I had no concept of America's history to the extent where I knew deeply what had happened in the past, even patients were reluctant to accept you as a caregiver, or they will question, are you the real nurse, compared to somebody else where the assumption is there that you are. But for us, people like me, and maybe male as well, are you the real nurse? So those are barriers you
Mm,
have to overcome and deal with, and where somebody else may not have to deal with those barriers that we
right.
have that are put upon us without reason.
You know that profiling can be so damaging to all communities and all peoples, and so it's really, it's. I'm glad we're having this conversation. I'm glad it's led to this because it's incredibly important to realize the time and energy spent profiling and all the storylines that we create is meaningful contact with another human you can't replace. So we've
Yes.
spent so much time in this negative space. So I'm so glad that you mentioned that. You know, in our last couple of seconds that we have together, what is a big takeaway that you have? What do you want our listeners to hear from you as a big takeaway?
I want us to realize the importance of knowing that each of us brings something to the table. And diversity should not be a negative thing. It should be one of the most positive words that we should be using. Diversity brings to it an array of different aspects. And when you have a wide array of aspects to choose from, your learning increases, it's broadened, and that is something that people are trying to take away from us. And so, say for instance, you speak Spanish and I speak Vietnamese and somebody else speaks English, and we're together working together. We are bringing something uniquely different.
Hmm.
Yet we collectively, we're broadening the knowledge of all of us. And so we want to promote that. We want to promote how each difference is unique and meaningful and positively impact others.
Excellent. Thank you so much. And thank you for joining us, Dr. Burke. I really appreciate you sharing your story. And thank you for the discussion about your wonderful book, The Unsung Heroes, Nurses. So we're really excited to share that with our listeners. And thank you all for joining us today for this episode. And we look forward to seeing you next time.